Hello, everyone, and this is Season 1, Episode 3 of Ben Snap and Chat, and I am Drake Jensen, and I'm with my co-host,
Cristie Vito.
And we're here to talk about the ABCs of EDS. How you doing, Cristie?
Oh, I'm holding on pretty good. There's a lot of letters to get through, I think, today.
We have a lot of letters. So first of all, we thought we'd do the ABCs. Now, we want to do a disclaimer here and say that us saying the ABCs of EDS does not in any way simplify any of this because it is an incredibly complex condition.
Incredibly complex. It literally affects every cell in our bodies from head to toe.
So can I tell just a really quick lowdown of the past 56 years, like in probably 2 minutes?
Let's do it.
So one day, like I wake up and I go to perform and I'm standing on stage and I'm completely off balance. I'm dizzy. I haven't taken anything. I haven't drank anything. And I'm completely off balance, feeling like I'm going to fall over in the middle of a performance. On the way home, I had an immense amount of chronic pain. It was a long car drive, and I knew something in my body was changing.
Mm-hmm.
And over the course of the next few months, I had some pretty severe symptoms. I was, again, like I said, off balance. I was having a tachycardic heart, so which means your heart's racing and then it stops. I was having this weird temperature problem where I couldn't regulate my temperature. I was like either freezing or sweating. I was having problems. We're going to talk about some personal stuff here, Cristie. Are you okay? Are you ready for this?
I am totally prepared for this.
Okay, so I was having pee-pee and poo-poo problems, if you know what I mean. So the pee-pee problem was that Drake was peeing down his leg when he was walking down the hallway. And then the other problem I was having was I couldn't poop anymore. It had, as they say in French, arrêté, stopped.
To put it nicely.
And then came all of these weird neurological problems, which was like my personality changed and I became a psycho for 6 months and I was throwing things and was excessively angry, more angry than I'd usually been. And and this puts me on this journey of going to the doctor after not having a doctor since I was 25 years old.
Wow. Okay.
And that started my journey. So that is my beginning with all of this. That happened 3 years ago, and it dramatically changed my life. What I didn't know in the course of all of this is, of course, I had something called hypermobile EDS, where the connective tissue is completely all defective in your body. And your connective tissue is everything. It's your heart, it's your lungs, it's everything holding your heart and lungs up. It's your uterus, it's your vagina, it's your penis, it's your ears, it's your head. It's everything you can possibly find in every inch of your body. And ours is all defective and it affects everything. And the one thing is that was most affected was my central nervous system. So that's what set me on my journey. So that's my story in a few minutes. So there you go. I took up, 2 minutes. So there you go. You want to tell your quickie?
Yeah. So I literally was born with a dislocated hip. And when we talk about connective tissue, it really, like back then in the 80s, I was told, oh, you're double jointed, put her in dance. And when I explain and talk to people now about what EDS and connective tissue actually is, the way I explain it is like, imagine connective tissue as the glue that holds your body up. And our glue is like silly string. So nothing stays in place. It affects our bones, our skin, our joints, literally like you just said. But it wasn't until I started having, similar to you, a lot of horrible, severe constipation, which literally no shit. And that was my first real diagnosis.
But Cristie, you don't look sick.
Right?
No.
So
do you get tired of people saying to you don't look sick?
People in my life that know me now don't say that to me because they know that invisible illness, like you can't tell if someone is disabled or not by looking at them from the outside. I saw this meme once and it said, like, 99% of my body is inside
Right.
my skin
Yeah.
that you can't see.
Point.
Right? So
Yeah.
you can't actually see what is happening.
No.
And so that it just, that was kind of like opening Pandora's box.
Yeah.
And everything
So
from there. Yeah.
You know, and you're how old now? I can't remember.
I'm 45.
40, I was going to say you're going to be 46. So you're 46. We're basically 10 years apart.
Yeah.
I'll be 56. But what I think we need to explain to people is that EDS causes an interesting thing to happen to your skin.
We have what's called like a velvety. Do you have the velvet skin? Because not every
It's
type of EDS.
unbelievable what it feels like when. So I am Yeti. I'm Yeti, right? So I'm so hairy. It's unbelievable.
Yes. But under the
and now
fur.
I'm thinking about the Uber commercial with Yeti, not spaghetti. That I can't even do it. It's like it's so. There's my ADHD. Sorry, we're going to talk about that in a minute too. What were we talking about, Cristie? I forget.
Oh my goodness, the two of us just.
So we were
go
talking
in
about velvety skin. So yes, if I was to take hair off my body, my skin is like, it's creepy. It feels like microfiber.
It literally is so soft, guys.
Yeah.
Like our skin, when I think about like the pluses of EDS, it's people look at me and they still question how old I am and assume that I'm like significantly younger than I am.
Yeah.
And that goes back to our skin and the texture, and
so it makes us look younger.
Yes.
We don't wrinkle as easy.
Yes.
And it's kind of, I can pull my skin like way far away from my neck because it's super hyper stretchy.
Can you do that other places or just your neck?
Everywhere. Yeah.
See, I have certain areas. So my neck can do it.
Yeah.
The little area like on my wrist can do it.
Yeah.
But there's other areas that aren't. I think it's important that people realize that there are 13 different types of EDS.
Oh my God.
And so it just gets very overwhelming and complicated.
And to be very clear, what we're talking about today, because we both have the same thing, and even though we have the same thing, you're going to see that there's similarities, but sometimes there's not.
Exactly.
I have hypermobile EDS, which is Ehlers-Danlos Syndrome, and so does Cristie.
Yeah.
And this is, people are going to go, oh, you have a rare disease. Right now, the stats on EDS is 1 in 5,000, and they think that's incorrect. They actually think there's more people that have it. It's just gone as either undiagnosed ghosty chronic pain. It's gone as chronic fatigue syndrome or the F word. F word I call it.
The F word.
The F word.
I think many of us have that.
Fucking fibromyalgia.
Exactly.
You know,
because
if one more doctor,
like
I really wanted to tell the last doctor that tried to diagnose me, which was only a year ago with fibromyalgia, to fuck off. Like it's the second time I've heard that. And it's like, I might have fibromyalgia as a comorbidity, as a symptom of what's happening to me on a grander scale, but it's not just that. And stop trying to push me out of your office or just push me off and give me a label before you even understand me.
The number of times I've been told, it's just anxiety. It's just in your head.
Or it's hormones. I guess women, fill me in here because I'm a dude, right?
Yeah.
So do women like get all this shit from doctors because they have like a period, and men always think that women are PMSing, and that do they blame it on that sometimes too?
Absolutely.
Yeah, because it's like smoking, right? Having your period is such a liability for women. It's like telling your doctor you smoke.
Exactly. Well, that must be it. Or if we're like a little bit overweight because of, as a result, not necessarily what's actually causing the chronic pain. Right. And so that happens a lot with women. And the reality is, most of us, it takes decades to get diagnosed.
Yeah.
And there's so many that aren't diagnosed.
So let's also be clear that this is a genetic condition.
Yes.
It's passed down from your parents. So if you have it, chances are your parents have it. I think there's a 50-50 chance if one parent has it that you will have it.
There's definitely, I think my mom might have certain things, like she's always had issues with her thyroid and like GI issues, which for me, the gut issues, the
Yeah.
constipation, the
Yeah.
vomiting,
Yeah.
the
Right.
all of that could have come from her.
Right.
But, you know, back
But
then,
you know,
nobody investigated it.
with anything medical,
Yes.
if your health practitioner, let's talk about HCPs for a minute.
Okay.
If your health care practitioner does not ask you right away, your signs and symptoms and your medical history come after that. Like, if they don't answer, if a specialist does not ask you this information, you're in the wrong office.
Exactly.
You're in the wrong office. Get out. Don't regard anything they say. I don't
It's
know.
just so hard because we
Yeah.
grew up in this society where it's like you trust doctors,
Like
what they
priests,
say exactly. And it's
like the
like,
president,
again, power unchecked. But
right?
it's 100% true. Like now with what I've gone through and literally like having to fight for my life and intervene when doctors just ignored me and didn't understand me, has very much impacted how I go into appointments now. Like in the past, it would
Yeah,
be
like a
like,
warrior.
yes, like I am the expert of my body. You can help me
Yeah.
as a doctor, as a specialist,
Yeah.
but you don't know my body better than me.
And some of
You
them
don't.
think they have God syndrome.
Exactly.
And
a lot
that's
of
like
specialists.
really bad. So
Yeah.
you know, like I said, with this one neurologist, rheumatologist actually that I seen, she was like, she looked at me and she said, "You don't have EDS." She said, "You haven't had a heart attack." She said, "You're 54 years old."
Are you
I'm
kidding?
like, I was like, "What do you mean by that?" I said, "Are you talking about vascular EDS?" I said,
Yeah.
"Because there's like 10 types." I didn't even know there was 11 or 12 types back then.
Yeah.
It's because I was just starting to figure this out. And so she was totally blindsided by this. She did not know. She was a person that was getting paid $100 or $150 or $200 for to see me for that 20 minutes.
Yeah.
And she didn't know what I knew.
Exactly.
That scared the hell out of me.
It really changes how you perceive doctors and how they treat us.
Well, it already told my bad central nervous system and my anxiety that I was not safe.
And that we don't need the extra stress on top of it.
Right.
We met at the scientific symposium, and in that we kind of heard a few different things in terms of like maybe having an autoimmune connection to it. And they're
Yeah.
actually doing a lot of research right now to come up with new diagnostic criteria.
Right.
So it'll be interesting to see how that's evolved
Yes.
since the last time they changed it in 2017.
And just so our listeners, you know, because I kind of want this episode to be an educational episode
Yes.
for people that are either new to this, have this,
yeah,
or have people in their families that have this.
so that they can understand and maybe know what to ask.
Yeah. So let's do a little checklist before we move on, just so we
Sounds
stay
good.
super organized. So let's do genetic connective tissue disorder. That's EDS.
Yes.
It impacts our collagen in the entire body. Check.
Literally.
Right. It affects joints, organs, and your total nervous system.
100%.
And it's not just being flexible. It's not just about being flexible, because lots of people can be hyper flexible or what they call double jointed, never have EDS.
So many doctors think that EDS is just flexibility.
Right.
And it's not. As we age, we actually start getting a lot more tight. And so because it's taken so long, so many decades for a lot of us to get diagnosed, by the time they do the Biden score, our hamstrings and our other muscles are tight because they've held us up for the last few decades.
And just to tell people what the Biden score is. So when you go to a specialist that is educated in EDS, oh, God bless the ones that are out there. Thank you very much.
Yes.
So when you go to a specialist, they're going to look at a bunch of different things. First, they're going to look at your signs and symptoms, and they're going to look at your family history. And the first thing they're going to do as a physical diagnostic is they're going to make you do a series of manipulations with your joints and see how flexible your body is. And then they're going to give you a score of 1 to 11.
Yeah.
And then what's going to happen after that is your score is going to dictate how close you might be to having this type of connective tissue disorder. I don't know about you, but mine, I was scored 9 out of 11.
I don't even remember what I actually got scored.
Yeah.
It was like a 3-hour assessment that I had with the Good Hope clinic in
Right.
Toronto where I
Yeah.
went. But
And
I also saw
I've heard really mixed,
geneticists.
and I'm not,
Yeah, that's the thing.
I'm going to be very
Mm,
non-biased on this podcast. And
yeah.
I'm going to say that I've heard lots about Good Hope, and I've
Yes.
heard some good things, and I've heard a lot of bad
Uh,
things where a lot of people aren't feeling heard.
and
So,
it's
and
unfortunate.
you can take it like there's two sides to everything for sure, but there's nothing more disappointing than when you read people waiting for an appointment for 5 years and them
Yeah.
finally getting it and them not being happy about it. And it does seem that I've read a fair amount of people from that were sent to this clinic in
Yeah.
particular felt this way, and then others were felt validated. So again, this is all based on personal experience.
It really is. I live in Ottawa, and I found that the resources that they had, so I went in 2019, and they had just started collecting data and research with the new diagnostic criteria that had come out in 2017. And I think that perhaps with the data that they've been collecting, they are seeing different patterns with people that have autoimmune conditions. Because if we want to talk about comorbidities that are common
Yeah, so
with EDS,
comorbidities, not to interrupt you, sorry.
so no,
Comorbidities are the conditions that stem from systemically from
yes,
having hypermobile EDS or other types of EDS. So these things, because connective tissue is so widespread throughout the body, it actually affects every body system.
literally everyone. And so they've kind of called the trifecta because it's there's these three conditions that seem to be highly visible and seen in a big percentage of people with
Right. And
HEDS.
that's either signs or symptom wise.
Exactly. And so the two are, in addition to EDS, we have POTS, which is postural orthostatic tachycardia syndrome. And basically for me, it's I can go from lying down. If I get up too quickly, the room spins. I'm possibly going to faint. The heart is going crazy, like it wants to go out of my chest. I sweat, the temperature regulation. All of this has to do with the autonomic nervous system. So it's a dysfunction because of our collagen to the nervous system, the central nervous system.
So basically, the way I describe this to people, because this is like, this is the crux of the whole thing.
Yes,
This is where it totally takes you and fucks your life.
pretty much.
It really does. It really, this has been the most challenging thing
Yeah.
that I've ever been through in my life. And I've been abused when I was a kid.
Yeah.
So I would go back there,
Yeah.
then go through what I went through the past 3 years. So the big thing about that central nervous system issue, because that central nervous system is made of all connective tissue,
Everything. Yep.
and that starts to malfunction. And how I reference this to people who are in total, like, in a total state of lack of knowledge about this,
Exactly.
I say, unplug your computer and go down your basement and throw it against the wall and then
Uh-huh.
plug it back in again and expect it to work.
Exactly.
And you have me on a bad day. That's
Try
what,
not to laugh
but
too much.
that's just the way. Isn't that true though?
But it is. It really is. And it's one of those things that it impacts so much that people might not realize that it's like a completely distinct, like people can have POTS and dysautonomia and not necessarily have EDS, but they often are combined together. You see them in conjunction with each other.
Right. So at the very top of the pyramid scheme, we
The
have
pyramids.
EDS, and then next to that, we have this POTS, which is
Yep.
affecting the cardiovascular system,
And
and
our
then
nervous system.
and the nervous system, and
Yeah.
then you have the next one, which is dysautonomia. And dysautonomia is basically the smashing of the computer against the wall and then plugging
Pretty
her
much
back in and expecting to be able to do your word perfect, right? It doesn't happen. And that's what affected me probably the most.
the most. And then the third that's kind of like pretty often accompanied is something called mast cell activation syndrome.
Oh Lord, are
And
we going to go? We're going to go there, are we?
I mean, I think it's important to at least touch on because
Right.
people might be having. So basically, what it is, how I explain it and how I understand it, it's not the textbook, maybe explanation. But for me, it's an immune response that acts like an allergy. And so you can get hives, you can get like swollen mouth, swollen tongue, itchy skin,
IBS,
IBS, because it definitely is connected to our gut, like
heartburn,
so much.
severe heartburn.
The reflux is next level.
We talked about this the other day. I think
Yeah,
not on any of the
not
podcasts
on
yet,
the,
but the reflux. This MCAS
yes.
thing is a real. So it's mast cell activation syndrome. So if you want to know what your mast cells are, you can do a quick chat GBT thing on it. But they're basically the boss cells of the immune system.
Exactly.
They're the micromanagers of your immune system. And to put it in the most layman terms I can, and to tell you why people with EDS are highly affected by MCAS, they call it,
Yes.
is because, do you know, I didn't know this. This is research, by the way.
Okay.
Do you know where the mast cells reside in the body?
My guess would be the gut, just like the neurotransmitters.
They reside in all the connective tissue of the body.
Oh,
That's where
okay.
most of them are, is throughout the body in the connective tissue. And what did we just say about people who have EDS? They have what kind of connective tissue disorder? They're defective. So
Exactly.
the mast cells are in there too.
So
So
when we say it affects literally everything in our body, it, it literally affects everything. And EDS, POTS, mast cell, that's all been part of the criteria for diagnostic in the past. And I'm curious to see how that's going to play into when the new stuff comes out in December.
yeah, so as we have all of these things, EDS and all the comorbidities of EDS, or the trifecta as it's called,
Yeah.
which is a new word for me. I like that word though. I'll be using that
Okay.
all the time. Trifecta. I feel like I'm intelligent when I say it. Okay, so but then on top of all of this
Yeah.
is this, and this is the reason. And I don't mean to be letting every practitioner or healthcare professional out there who's seen an EDS patient
Yeah.
and giving them that dark stare and that doom and gloom diagnosis of the F word,
The
which
F
is
word.
fibromyalgia.
Yeah.
But this is the reason why most practitioners do this, is
Yeah.
because the one thing when people start to go to the doctor about this that they start to talk about is this extreme chronic fatigue.
It's one of my worst symptoms. Like the pain, because we live in constant pain, high levels. Like most of us live at like on the pain scale, like a 5 to 7 normally. But for me, it's the exhaustion, the fatigue. Like, and it gets compared to like, oh yeah, I'm tired too.
Right.
But no, if you have a nap, you're going to feel better after that nap. I can sleep
Can't
for
nap
10
by
hours.
I can't nap, by the way.
I have a hard time with napping.
I
I
have
have
such
a
a
hard
hard
time with
time.
sleep in general, which I think is another probably.
Let's talk about that in a few minutes.
Yeah,
Yeah.
because I think it is something common that a lot of us.
I'm having issues, so I just wanted to know. I want to
Yeah.
kind of want your advice too. So,
I
because we really didn't rehearse it. We don't rehearse our podcast, by the way. We don't rehearse
no,
this stuff.
this
This is her and I having our conversations, and this is how it started. So you and I were having great conversations,
yeah.
and we said we need to bring more voices forward about this type of thing, and we need to talk about this, and we need to talk about poop, and we need to talk about sex, and we need to talk about all this dysfunction, because there's no shame in any of this. And
There
our
really isn't.
conversations were great, and we
Yes.
thought maybe people might like to hear this.
Well, it's been such an amazing thing to be able to connect with you because you get it. And
Mm-hmm.
I think that is really important for other people to feel seen and heard and like, oh, those people, I've learned so much from the EDS community,
Yeah, me too.
like random weird things that I'm like, oh, that's a weird EDS thing.
Yep.
Like I was born with a flattened palate. Like my palate wasn't formed properly.
Yeah.
And through EDS community, and even at the conference we went to, they were doing like 3D images of our faces. And that seemed to be something that they're seeing that is very common
Oh,
in
it's a
people with
trait.
EDS.
Yeah, it's a trait.
Yes.
So I have this really high palate
So
inside my mouth, like it's really tall in my
so
mouth.
you have that too.
Yeah.
When I was young, because I had that, my parents were worried because I couldn't breathe through my nose and it affected all these things,
Yeah.
that I literally had my jaw ripped apart with
Yep.
this like mechanic thing
Ugh.
to try to help recreate the palate, how it should be formed.
No. I'm all about God making you the way you are. And I'm like, no, don't touch me.
At that point, I was still a kid
I
and I
know it's not
didn't
your
really have,
responsibility.
I mean,
Yeah.
like the doctor said, this is what you should do. So my parents said, okay,
Yeah.
well, this is what we're going to do because
The
this is
doctor
what's in the
said.
best interest of my child. And now we're going back. Even like I was born with a dislocated hip. And at the time they first put me in traction, I was like a few months old.
Wow.
They put me in traction. That didn't seem to help anything. And so I ended up being literally like in the splits in a cast that kept my legs in the splits for 6 months.
Oh my God.
That's something that they don't do anymore
Well,
because it
we're a
didn't
different
fix
generation, right? We got different
Exactly.
treatment. Yeah.
Exactly.
So let's talk about that. You're segueing this. You're just opening the door for so many people that have what we have, because a lot of doctors and healthcare practitioners are not properly educated and do not keep up with the current. I don't like to call it trends because it's not a trend. Current knowledge, current information. And so what happens is we end up getting sent to specialist upon specialist. And a lot of times the blood work comes back and everything is perfect. But the thing is if you went really deep in the blood work and looked at inflammatory markers and deficiencies, then when you start to see there may be a problem. But on the surface, it seems, everything is good. And so you constantly get doctors telling you it's all in your head, or you have anxiety, or you're on your period, or you're going through the change of life, or it's andropause. There's so many things that we hear as patients, and it's affected so many people. And what happens is we go to the doctor, and you end up having to like put your night outfit on, and you go armed. I mean, we go armed with like a wealth of information now before we see anybody, because we go, no, well, here's what the medical stats are. I do this with doctors, but I have done this, by the way.
Me too. I do it all the time.
Yeah.
And now that I show up, at the start I would get really emotional because I'm like, why are they doubting me? Like, I haven't been able to go to the bathroom in like months.
Yeah, it's like they're going to get in their BMW and they're going to drive the fuck home after making $200 on your appointment. And I keep stressing how much money they make, because they have a responsibility for the money they make. And they don't give a shit, no pun intended, that you can't.
Literally. And the other problem is that modern medicine is siloed. And so we have conditions that overlap. So I might be sent to the cardiologist for the POTS.
Yeah.
But then it's affecting my nervous system in ways that, like in the last year, I haven't been able to feel my hands because of small fiber neuropathy.
Yeah.
And it's just, it's probably EDS or POTS related.
Yeah,
and
or they start to look at you like you're a psycho.
Exactly. Like, they can't be that wrong with you.
Then they start to, they either want to put you on some type of anxiety medication, or they want to send you to a psychiatrist or a psychologist, or they recommend therapy. Now, all of these things can be good treatment for people like us.
100%. I would never, like, cognitive behavioral therapy and dialectical behavior therapy are two things that
we're going to do the mental health. We got to do the mental health episode.
Yeah, because it really is important.
Well, we could do an hour just on the mental health episode.
Easily.
Yeah.
Like, yeah.
And so like the whole basically what a lot of doctors do is they use a symptom, which is anxiety.
Yeah.
And then because in the medical diagnoses book
Yeah.
that they have, which is the big Bible, and that they change once in a while, there is
Not
a
enough.
anxiety disorder.
Yes.
So it's easy to throw a blanket over. It's kind of like, when your house is really dirty and company's coming over,
Yep.
you want to throw stuff like just
Yep.
push it in the closet. And that's basically
Hide it.
what calling somebody with EDS is suffering from EDS and having anxiety disorder is.
Exactly.
And that's why people start to get PTSD. Now, some of us have great doctors and some of us do not. I have had my mixed bag when it comes to doctors. I have 4 practitioners or 3 practitioners right now that are amazing and have been very good to me and very knowledgeable. And I'm very lucky, but it took me 2 years to get to them. And I had to fight and clamor my
Yeah.
way to the top and pay for some of this stuff myself
Yeah.
because they weren't listening.
Yeah.
And, it's been a real battle.
It's a horrible battle. The fact that they look at us like we're these mysteries, like medical mysteries. And instead of actually like acknowledging maybe our tests aren't as capable at this point to be able to diagnose some of these like lesser known things. Like you were talking about inflammatory markers, but when I was having my first inflammatory bowel disease flare,
Flare, yeah.
my inflammatory markers were pretty much non-existent. And so when I was finally, after months of bleeding and ending up in the ER, finally sent to a gastroenterologist, GI, who did scopes. And before the scopes, he said, I don't think that you have IBD just based on the blood work. And he was shocked.
Here we are
when
again
he
with
went
this.
inside.
Yeah. So your blood work was normal and your
Normal.
large intestine was completely inflamed. So
Literally.
this is what I was saying before. The blood work is always normal, and they use the blood work as this, like, it's their sounding board.
Exactly. And even like recently, I've mentioned to you that I'm in this process now of apparently maybe I just tested positive for lupus. And usually, so I don't want to get into too much detail, but there's an ANA test, which is one of the inflammatory markers that they do. And because my ANA was always
within range
right. And normal, they never did any other tests.
They didn't go deeper, like I was saying before. Whereas if they would go deeper, they would see that deeper in the blood work, there are inflammatory markers that are signaling that there is something wrong.
Exactly.
Right. So you're just proof of what I just said.
And I think many of us are.
Yeah. Yeah. So here's the other thing. I've talked to many medical practitioners about this, and the general consensus that I hear is that within normal range is like BMI.
Yeah.
Like a BMI. You know how when they tell you should, like they tell me I should be 175 pounds? Do you know what I would look like at 175 pounds?
Yeah.
I wouldn't be pleasing.
It's ridiculous.
The aesthetic would not be pleasing. So anyway, basically what this is these within normal ranges.
Yeah.
Because everybody's genetics are different, and we know this.
Yep.
What's normal for one person, like a couple of points above on the thyroid or a couple of points below, may not affect one person, but may send the next person into a massive depression.
Exactly.
So these normal ranges can never be really considered normal. We're at fault with a lot of these things still.
It's not developed enough. And I think that's the first time I heard a doctor. So the neurologist that did my, for the small fiber neuropathy, and he literally said it might be the lack of available technology to actually identify what's going on. And I was blown away, like a doctor actually admitting that they don't know everything.
They don't.
It was shocking. But for them to actually admit it.
Right.
Have you ever heard that?
My doctor? Yeah. Yeah. He's very, very, I'm very fortunate. Can I talk for a second about my doctor?
Yeah, for sure.
So what happened was we didn't have a doctor up here. We live in Quebec, up in the country in the middle of the woods, and we got sent to a doctor. We got a letter in the mail. And it said that both you and your husband have an appointment. So they gave us a joint appointment, and the doctor came out looking like he was from the operating room. So he had scrubs on, and he had booties on, and he had gloves on, and a mask on, and something over his head, and a lab coat. So when he got us in, this is a whole episode on its
Yeah.
own. But
Yeah.
basically what happened is this guy had a major bias for gay people. He was a Christian from Africa,
Yeah.
and he doesn't believe, I don't think, that gay people have any validity, because what he did was he proceeded to examine me. He roughed me up on the examine table, like he was rough with me.
Wow.
And then he said to me, turned around, and he said to me, and Michael was sitting right next to me. He said,
Yeah.
you have had anal sex, he said, with him? And I said, well, we've been married for 18 years. Chances are we've had anal sex.
Right? Yeah.
And he said, you have HPV in your rectum. He said, and that's all of your problem.
First of all, the amount of medical PTSD that I can only imagine, well, I face myself, but not in that kind of situation, it should never have happened in the first place.
No, it was the first time I was ever traumatized medically.
I mean, I can understand why you were traumatized. That's absolutely horrible.
Can I be honest and say I was completely privileged ignorant before that? Like, I never thought. I had such esteem and confidence in doctors. I was pretty blind. So when that happened to me, I was, fucking blindsided. He never even looked at my ass or my any part of my anatomy. My clothes were still on.
Then how did he diagnose HPV? Even if you had HPV.
Well, this is the thing. So anyway, what happened was I got really angry because that was a dead end appointment. That was it. He threw me out of the office, by the way. He told me to go.
Yeah.
He said, I don't have any more time for you. That's what he said. And he opened the door and kicked us out. And then I went out in the truck and I was so angry.
Yeah.
And I said to Michael, I said, there's no way. I said, I'm not. We went right back in and we filed a complaint. And when we told the secretary, the medical secretary, what happened, she was mortified. And then we got the College of Physicians and we started a big battle because I wasn't willing to take that lying down. But the one thing I did was I took my own money and went and had an MRI.
Which is insane.
When my MRI,
we're in Canada.
Right? When my MRI went into the system, because here in Quebec, what happens is it goes into a centralized system.
Okay.
His boss is now my doctor. So what happened was
the irony.
Yeah, he seen Michael's case. Michael was having a few issues back then, and then then he seen my MRI, and he called us up and he said, "You guys need to come in." He said, "You have some problems we need to look at." And then when I got in the office, I mean, you can imagine the discussion that day. I said, "Are you his supervisor?" That's what I asked him. I said, "Are you his boss?" Yeah. And he's like, "Yeah." I said, "Poor you." I said, "Poor you." But I said, and I told him right there, and then I said, "I'm done with this, by the way. I've been here. I'd seen a couple of doctors. I've seen another one before him who completely dropped my case and just didn't call me back."
I've been there too.
It's just been insane, the amount of abuse in the system.
It's horrible. And then especially when you have something that's so complex and that in a lot of cases can be overseen by different specialists. I've been bounced back and forth between so many rheumatology, cardiology, neurology,
Well, here's the other thing. Do you have a doctor that says you can only talk about one thing when you go there? That's a rule in a lot of doctors' offices now, by the way.
It's ridiculous the number of times that I've gone.
Yeah, time.
I'm honestly very lucky and privileged that my parents actually pay for me to have a private GP, because I lost my doctor during COVID, and I honestly never thought that would happen. The medical system that we have was already
broken.
Shit.
Yeah, it was broken.
And it's just continued to get worse,
worse and worse
and
and worse and worse. And we call it shit because it is shit. And on this podcast, we are like totally, we have no idea what we're doing to start with, and
Yes.
but we're totally honest.
That's it.
And shit's shit. And this has been a lot of shit. So speaking of that, speaking of shit,
as we transition to shit,
eventually you have to. So let's talk about what people out there, you know, because we've got like 20 minutes left. So let's talk about flares, because most people don't understand that this is not an ever-present thing. So not every day is really bad, but there are times where we get what we call flares, and people with lupus will know, people with CFS, chronic fatigue syndrome will know, fibromyalgia will know, and I'm not dismissing the people that have been diagnosed with fibromyalgia during this episode either, by the way.
No, it's
it's just that they're using that on us, and it's a blanket diagnosis. So I just want to be very clear with this, because people can become very confused about things these days and take things for face value.
Yeah.
But you know, this whole thing about flares, they happen, and you could have 2 a week, 3 a week. They're triggered by things like food, environment, weather, air, stress, chemicals, wildfire smoke. Smoke, Cristie, was one that really did me in last year.
Do you have asthma?
No. It made the MCAS really bad.
Wow. Okay.
Yeah.
For me, it's the asthma. It made the smoke just made everything worse. The breathing. Yeah, it was difficult.
And so I'm dreading, right? People say, "Oh, I can't wait for spring," and I'm like, "Go to hell! I don't want to talk about it because it's going to be wildfires." You know?
Yeah.
And I have to think about the smoke again, because I got really sick.
Melt.
The smoke made my nervous system crazy. It was really bizarre what happened to me. What happened was everything, like my heart rate increased. I started to have anxiety, and it, you know, could have been from the fear. Of course it could. And then it sets everything off. And then we got this multi-systemic war going on, because that's what happens when you have a flare, right?
Exactly. It's just everything is on fire.
Yeah. And then just like your bowel, you have to stop, because if you don't stop, right, you don't have any energy left.
Yeah.
There's no energy during these flares. I don't have any energy during these flares.
So I've gone through some like serious surgeries where like life altering. I've had my entire colon taken out because of the IBD.
Cristie, when I heard your story, can I be honest with you? It's like you were that, you know, the Legally Blonde girl that had every possible thing happened to her in her life, and she's still waving this flag of positivity. And I was sitting there going, is this fucking chick for real? Sorry, I peeked the monitor, but that's what I was thinking to myself. And I was like, Drake, and you know, me talk to me in my head.
Yeah.
And I'm like, oh my God, you haven't had any problems next to this one. And that's what really got my attention, right? Was when they're like, they took this out, and now I've got that, and then they did this to me, and then that happened to me. And I'm like, oh God, I've been very lucky. I really felt great. Your talk made me feel grateful, because you were really, like, was this like disaster for a long time.
I mean, it's been like a good decade before my colon was taken out, where and then 4 years of going in and out of surgeries, and you know, like
all this inflammation constantly.
Constant.
Yeah. And all these dietary problems and all these things, you know?
Like a lot of us have GI issues, whether it's the constipation, which I think sounds like a lot of people.
No poopy.
No poopy for us.
My budgie says that now. You know, I taught my budgie to say his first name is Victor, and he literally poops everywhere. So his actual legal name now is Victor Poopy. And so he sits up on the rail, and all afternoon that's what he says, Victor Poopy. And it's like us, it's with us, it's no poopy.
No poopy.
Oh boy.
And it's a problem.
Cristie, you know, I had World War III in the bathroom this morning. We talked, I'm trying not to laugh too hard because I peeked this damn thing a couple of times already. I'm telling you, like, I hate to say this, people are going to go, oh my God, he's talking about shit again. But listen, it's a major problem with us.
It is.
You have to understand, and we're going to try to drive this home, but I had 3 babies in the bathroom this morning. I think I officially know what it's like to have a child. And it really is, you know what? I'm sweating and I'm nauseated and I
Yep.
feel all this pressure and my pelvic floor is like feeling like it's going to die. And it's just, honest to God, we're talking about the very basics of humanity being able to go take a
Exact.
shit. And
Literally.
it's something that we really all have a problem doing.
And again, it's to the elasticity in our collagen. And so, like, the peristalsis, the movement that we experience
That makes you
in
poopy
our
poopy.
exactly stops working and
Yeah.
it stops. I had a scope and my GI was like, I don't even know how this is possible, but I don't see any peristalsis
Right.
in your small intestine.
So my mother is the one that passed this on to me. And she was constantly going in her 40s for GIs because she was having these
Yeah.
problems. And they were
Yeah.
finding food in her system for days, like
Yeah.
undigested food sometimes,
Yeah.
like stuck in her stomach. And they couldn't explain it. And they kept telling her, like, we don't know what it is. It's, oh, it's because
Yep.
you had a stomach surgery. It's because of this. It's because of that. But it was EDS. It was EDS.
It,
And my mother still
yeah.
isn't diagnosed, by the way.
Does she, like,
She
is
got
she
that.
interested in getting a diagnosis at this point, or is it something
No,
that, and that's the
there's a
thing.
multitude of complications with my
Yeah.
mother.
Yeah.
And, I don't want to talk about my
No,
mother,
no, no.
but
It,
the thing is that it's been a really difficult, complicated life for
yeah.
her. She's had this her whole life and it's
Yeah.
been basically untreated. And
Yeah.
when people say, oh, you don't need a diagnosis. Let's talk about that next because it doesn't matter. There's nothing you can do about it. Well, let's talk about that in a minute. But that's basically, my mother has never had any type of treatment. And when there's a multitude of treatments for EDS.
Yeah. And going to the constipation though, it like, because we always
Back to the
circle back
shit,
to
folks. Back to the
the
shit.
the shit. Like, just to put this in perspective, because when we talk about, like, there's no movement and that impacts things, like, my surgery to remove my colon was supposed to be like a quick, like, 2 to 3 hour process. And because the stool was so compact, like, I would go weeks
Oh
without
my.
being able to go to the
Oh,
bathroom.
and it's so painful. It
It's
is so painful.
the things that I have had to stick up holes that are not humanly, like, I
It's
shouldn't be
Friday. Have a martini.
exactly.
It's sex with Cristie.
But, like, I developed rectocils, which pretty much means my rectum was coming out of the bottom. And all of these horrible things, the enemas,
Yeah.
the,
My
like,
mother through her all of her life, and they kept on blaming it on, let's put this in quotes, woman problems, as
yeah,
doctors call them, because most
yeah,
doctors are men and they don't have any friggin' like concept
idea.
about what it's like to be a woman.
Well, they
Because
also haven't done any
Well,
research on women's
they read it
bodies.
in a book, so they read it in a book, just like the nutrition part. They do it for a day and that's all they do.
That's
Isn't it?
it.
That's it.
It's like a 1 hour
Yeah.
part of
So if you're
their,
wondering why your doctor is feeding you pharmaceuticals and not telling you to eat good food, then there's the
yeah,
problem. But back to your problem. It's like,
yeah.
it's not that fun on a Friday night. Trust me.
I know it's not the number of times that, you know, it's not. It's bringing back a little bit of PTSD, if I'm being honest. Like, some of the things that I actually had to do to myself to try to get some relief.
Right.
Because going to the ER, they would question me every single time. Do you actually have IBD? Because of one random specialist that I saw
Right.
in the ER said, "Oh, I don't think she has it because I don't fit the profile of a
Well,
normal person with IBD."
right. And
Because I had the opposite.
we have all these genetics and we're trying to
Yeah,
shove a round peg into a square hole constantly. No
exactly.
pun intended,
Exactly.
after us talking about you having
Literally.
to do all that stuff with your
All the,
finger and stuff like that.
right? Like,
Like, but no,
it's
but
not pretty.
seriously, people don't understand. Like, I think that's one of the dysautonomia and the central nervous system and the anxiety is
It's all
probably the
connected.
worst for me. But the anxiety and the constipation
The
together, I have
it,
anxiety because I can't shit.
I've been
And
there.
one thing leads to another because it goes,
Right?
but I'm always constantly being very aware. So let's talk about in the last 10 minutes, right?
Yeah.
There's a lot you can do. There's a lot you can do. So we want to give people resources in the links for this. We're going to put in the links for the Ehlers-Danlos Society of North
Yeah.
America. There's an EDS Canada. We're going to put that link in there.
So you can research and
Do
read
your
a little bit
research,
more.
go read.
Yeah.
And one of the other things, I'm going to put a link to one of my favorite people in the EDS world, Dr. Claire Francomano.
Amazing.
She's a great person. I love her. And so I'm going to put Dr. Claire's, because Dr. Claire helped me navigate my diagnosis through her YouTube videos. So if you want to learn about EDS and you want to know like the non-layman's terms and more of a
Yeah.
technical explanation as to what may be happening to you or a family member, please
Yeah.
go to Dr. Claire Francomano's YouTube channel. And the link will be in the podcast right underneath. And we would appreciate your comments too, by the way, on all this stuff. Hey, Cristie, we want to talk
For
to
sure.
these people.
We want to hear what you guys have been experiencing as well and things that have helped you. Like we can share what's helped us, but the more we share, the more we learn, the more empowered we are to go into a doctor's office and be confident and not like, oh, okay, well, they think that it's this.
Right.
No, if you don't feel like if that doesn't make sense to you, you need to push for it. Like I had a doctor who told me you can't have, I don't want to send you for a colonoscopy. You're in your early 30s. Like you're too young for that. And it's like, no, I've been bleeding for months.
Yeah.
So you know your body. Trust it. You're the expert 100%. And it took a long time to be able to get to that point. But educating yourself, knowing what your symptoms are, talking to people in the community, it's all empowering and you can bring all of that information.
Yeah. And speaking of, I started a Men with Ehlers-Danlos Syndrome page just because I felt so lost and I was
Yeah.
in the world of the woman and
Yeah.
on the EDS pages, and I felt like, oh God, am I the only dude that has this out there? And
Yeah.
anyway, I wanted to start, and I've got a couple hundred people there. You're there, and there's some great women on there with us too. And, I look at the way they see this, and people say, well, this is not a man's disease. Most men don't get this. But I think what the problem is that men, and here we are, here's my
Yep.
side of the whole thing, is that, especially my generation, we were taught to be,
Yep.
oh, well, be tough, suck it up.
Yep.
You're going to get old, you're going to have pain and blah, 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 and all this stuff. And men are programmed to shut down. No wonder some of them become psychotic. So, as a man, I completely understand that, but
Yeah.
my ego as a man, I don't really have that. Like
You've put it in check.
I'm
Yeah.
very duty, as we
Yeah.
know, but
Yeah.
but at the same time, I have my Easy Bake Oven collection. I
Right.
don't allow anything to affect what I do.
Yeah.
I am my own man.
Exactly.
And the thing is that I just didn't have a problem talking about this, and I still don't
Yeah.
have a problem talking about
Yeah.
this. I will talk about my rectum and my
Right.
sex parts and what sex is
Yeah.
like with this, because it's all very complicated, by the way, and all of the other things. And you'll talk about pooping and what you've had to do to scoop it out.
Right.
This is our lives.
It is
But the men, the reason why we don't see a lot of
the
men is
tools,
because they're not talking about it.
the words.
Even on the EDS page, I find the men on the page are quiet until they are provoked. So I would like to see them talk a lot and express themselves a little bit more, even if they want to rant. I don't care, because sometimes you just want to rant.
And that's the thing, having a community where you feel seen and heard is extremely powerful and very important for people like us.
Yeah.
And men, like it's interesting because I did write in the group
Yeah. You were
yesterday.
like Den Mama. Yeah.
Well, because I'm curious. I want to see what their experiences are and their perceptions as a man. And a lot of them were bringing up symptoms that I experience as a woman,
Yeah.
but I think they're just not used to talking about and assume maybe that the experience has a gender aspect. And, like things like endometriosis and that's obviously going to be in women.
Did you
But
see a lot of the comments when you were in there? There was people talking a lot about pelvic
the
floor
pelvic
dysfunction,
floor and
which
the
is
SI
always
joint.
it's always dismissed. When I talked about that initially, with
Yeah.
the doctors would just say, "No, that's a woman's problem." And with
Well,
people with EDS, it's an everybody's problem, because I'll
it's
tell you,
an
my pelvis destabilized, and I have two labral tears, and my pelvis is not in the greatest of shape. So I've had to be very vigilant with my pelvis and my butthole and all of this. I have a therapist in Colorado, Robin Fogg, and I met her at the conference. You know who I'm
yeah.
talking about. And
Yeah.
she's always talking about my butthole. I talk more about my butthole with like, she's like a physical therapist, pain
Yes.
management, and
Yeah.
nutrition specialist for EDS. And she's always saying, okay, Drake, you got to let your butthole go. She knows how hypertonic my pelvis is. So men
Yeah.
have this problem.
And so do you, like, for me, my pelvic floor issues are all because of constipation. Do you, as a man, is that like, do you think that's the root, or do you think it's the instability because of the flexibility in our joints and our
100%.
spine?
100%. It's the instability that's causing
Yeah.
everything. So I had a complete destabilization. We couldn't figure it out, but both
Yeah.
labral ligaments were torn. So and one was torn worse than the other. They still are, because they don't want to do surgery on it, because he wants me to avoid surgery. And we haven't really
Yeah.
talked about that. But people, because we have connective tissue disorders, surgery is really, really complicated.
I know firsthand how complicated it is. Like my stoma, the skin around my stoma, because our skin is so
Fragile.
gentle and yeah,
Yeah.
it tears very
And it
easily,
doesn't heal very well.
and it doesn't. The
Heals.
types of scars that we have, like
Right.
I pretty much have a hole in my stomach that I'll always have
Yeah.
because of the surgery and the stoma and the hernia. Like, we stretch.
Yeah. So I have the hernia too, right? Did I tell you? Yeah, I
No.
have a hiatal hernia. I've had it forever. And that's what makes the flap at the bottom of my esophagus is always messy because of that.
Ah,
But yeah, that whole thing, the whole surgery thing, this is why diagnosis is so important. And please don't
it
let
is.
some uneducated medical professional tell you
No.
it's not. EDS needs to be diagnosed because of the surgical implications if you
Implication.
have to have surgery. So please take that very seriously. Do some research on that. Again, we are just here to
Yeah.
topic these things. And if something's tweaking your ear and you're feeling like this might be you,
Yeah.
go talk to your doctor.
Trust that instinct.
Yeah, we're not giving people any medical advice on this one.
No, we're not. And we're not diagnosing anyone.
No,
This is just our experiences.
this is the world the EDS world through our eyes. And we've just basically scratched the surface today.
Literally scratch the surface, because we were originally going to talk about identity and how that impacts us. We could do a whole other episode just on that and talking about the idea of strength and masculinity versus, like how that impacts our daily lives and how we see each other and how others see us.
Yeah, and how all of those things are just labels, and we're all just
It's
humans
all,
affected by so
yeah,
many things, because
yeah,
we are all very unique
yeah,
genetic beings, and it's the genetics that make things complicated, not so
yes,
much we sometimes use sex, and it's like, oh, well, men don't report this and women don't
yeah,
report that, or
yeah,
women have this and men don't have that. It's
yeah,
not so much that
no,
EDS levels the playing field because we're going to find this out down the road, because
yeah.
more and more men are going to come forward. So
I
it'll happen
100%.
eventually, but people like me have to start to talk. So
That's the thing.
yeah,
People
exactly.
don't talk, men don't talk. And
No.
so definitely not in a doctor situation.
Yeah.
Like, I know from my
We
dad, men don't like going to the
I
doctor
hated it.
and they avoid it.
I just went for the first time when I was 53.
That's
Like
like,
I went when I was in my 20s, because we had a family doctor back then, and that's
yeah,
when they diagnosed me with the hypermobility
yeah,
syndrome.
yeah.
And I
HSD.
was like, that's some type of, bullshit diagnosis.
Hmm.
I'm going to go do whatever I want. I was
Yeah.
24. But so for me, I didn't go to the doctor with this until I was 53, until I was on
Had
stage.
to.
I had to, because I knew
Yeah.
I was going to fall over on stage one day.
And I think that's part of the issue with men not feeling like they're able to bring stuff like this,
Right.
because even just with some of the comments on my posts, like they see things like the chronic fatigue and pain more as like a woman's issue.
It's so true. And it's almost like they're
Eh,
having to use it like it's almost shameful.
yeah, and it's
I noticed that.
not.
Yeah, it's not.
No, it's definitely something that I really noticed in how they responded, and I was like, the, "You're just like us. Like we're part of this what we call a dazzle
Right.
in our
In our zebra community, we
community."
are one and the same. And
Do you
speaking
want to?
of one and the same,
Yeah,
like we really want to make sure that everybody out there who's listening, hopefully you take something away from what we've said today. We know this has been probably like you're going, oh my God, the two of them have ADHD, but we but we want to make sure that that you're heard too. So make sure you leave a comment down below. I'm pretty sure there's spaces for all of that stuff
oh,
underneath there. Leave
we'll have to
comments,
figure
and
that out.
Cristie and I will be monitoring. And if you have something that question, fire it at us, and if we can help you out, we can. And if not, we can send you to a place where they may have an answer for you.
Yeah,
And this has
we
been
want you to feel like you can speak, and
yeah.
it's important.
And this is the only the pilot episode of
Yes.
EDS. We're going to topic a lot of. I think we could just do a central nervous system
Easily
talk about this stuff and how we're affected by this stuff. And so hopefully it's shed a little bit of light on either something that may be happening in your life or a family member's life that you seemingly have a problem, because I know a lot of people in my family have a hard time understanding this.
Yeah.
And I'm sure, Cristie, you too.
In my I think most of us have that experience, unless it's something that because my parents aren't diagnosed with anything. I'm literally the one in the family that has these chronic issues.
Interesting. I wonder where yours came from.
Apparently there can be people that hold the genes,
right,
that don't actually
they don't
express
develop
them.
but then it's expressed in the children. That happens.
Exactly.
Of course it does.
It does.
Okay. Right. Okay.
Yeah.
Well, that's up. We can do like 4 different episodes from just what we stemmed from talking
about today
during this episode. So thank
give
you.
Us your questions.
Yes, give us your questions, your comments. We're going to have a Facebook page. You can look at the Facebook page, Ben, Snap, and Chat, and leave your comments below, and we'll try to get back to you. And one of us will anyway. It'll be you or I, or both of us. Maybe they'll have to hear from the both of us.
Probably.
This is the 3rd episode now. This will be we're going to be dropping them all at the same time. So if you're listening and you've listened to all 3 episodes, thank you very, very much. We really appreciate you.
We really do.
So we're going to have to talk about the next episode, but we really haven't talked about that yet because we really don't know what we're doing.
We're a mess.
We're a hot mess. Yeah. And we're 2 minutes over too. But it's okay. We don't abide by the rules of the real world.
We really don't. We're rebels when it comes to that.
So we can go like 103.40 and it's going to make us feel accomplished.
Right.
Yeah.
We're taking a stand
right
against
now.
The
we're on
system.
one of our ADHD rants, by the way. We do this when we hang up, we stay on the line for like another hour, and then we're both exhausted and we're terrible. But anyway, so we're going to be on to the next episode. We're going to have an episode a week coming up. So we'll be sure to post on our Facebook page and Instagram pages what's coming up. And if you have any ideas, we'd love to hear from you.
We can't wait. Thank you again.
Thank you, everybody. And I am Drake Jensen.
And I'm Cristie Vito.
And you've been listening to Bend, Snap, and Chat.
See you on the flip side.
Bye, Cristie.
Bye, Drake.
Happy Friday, girl.
Enjoy it.
Bye.